You may have dreams like me of one day having a well-defined jawline and never having to pull your shirt up over your double chin when you're lounging in bed watching TV. You know who you are. Maybe you think you aren't ready for surgery, and perhaps you've hung your hopes on a movie star jawline on that silver bullet of an injection called Kybella. But are those simple 3 rounds of injections really going to give you the results that you want? The answer? Probably not. Kybella was released with FDA approval in June of 2015 and was marketed as this miracle treatment to help you get a better jawline. It's made up of a deoxycholic acid, which is a bile acid found in the intestines that really helps you digest your food. This acid is approved to be injected in the fat making up the central part of the neck to help dissolve it and in turn give you a better jawline. The first issue I have with Kybella is the cost. Kybella is recommended as a minimum of 3 treatments, but here's the problem with that recommendation. In the study that Allergan did to achieve their results, which is available on their website, they did 6 total treatments. A single session of Kybella in my office when I was offering this treatment was $700. So after 3 treatments, you're looking at around $2,100. But if you were to do 6 treatments like they did in the study, you're looking at around $4,200. And at that point, you've already invested more than what it would have cost to do liposuction of your chin and neck here in the office. The second issue is the pain. These treatments don't take very long to do, but you do need to numb for quite some time for the injections. And then the numbing cream really doesn't do anything for the burning sensation you get under your skin after it's been injected. Using a cannula can make the experience a little more comfortable, but still, it burns. The third problem is the prolonged recovery time. These multiple treatments mean that you have a long time to fully recover, as you're going to be swollen and often bruised over a period of about 3 months, if you're actually lucky enough to only need 3 treatments. If you have that kind of downtime available, great, that's good for you, but a lot of us don't have that. So instead of having a couple of weeks of soreness, swelling, and bruising with just 1 liposuction treatment of your neck and jawline, you've now spent 3 months swelling and deflating from Kybella treatments. That just seems like the long way around to get the results you want. And sometimes that long way around doesn't even get you what you want, which leads me to the 4th issue I have with Kybella, which is the inconsistent results. Some of my patients would get amazing results with just 1 treatment. Others would have a similar neck profile and would need multiple treatments to get the same results. It was frustrating because the results were so variable from patient to patient, and I didn't really have a good explanation as to why. The 5th reason I stopped injecting Kybella is that I would have patients return weeks to months later complaining that the skin where the fat was dissolved was now loose and jiggly. I could never pinpoint why this occurred, but my suspicion is that it also dissolves some of the attachments of the skin to the deeper tissues, leaving the skin slightly looser than before. So because of the lengthy recovery times, multiple rounds of bruising and swelling, inconsistent dissolving of fat between patients, and costing almost as much as chin liposuction itself, I opted out of using Kybella in my office. But that's not the biggest reason why I stopped. The last issue, and it's my biggest issue with this treatment, is that it's approved only for treating the central part of the neck. Sure, you could treat the other areas of the neck, but if you get too aggressive, you run the risk of injuring the facial nerves, causing facial paralysis. Facial function typically comes back after a few months once the nerve repairs itself, but it's not a great experience for the patient at all, nor for me as the injector. In my opinion, if you just treat the central part of the neck with Kybella alone, you're doing yourself a disservice. Why? Because a great jawline is more than just the area under the central part of the chin. It takes a lot more work to get the jawline on the sides to shine through, and Kybella isn't a great option for that due to the increased risk of nerve injury. So if you want to learn all about what I focus on to make a great jawline with chin liposuction, you can watch this video here. I'm Dr. Paul Pearce, and I hope you learned something today. We'll see you in the next video. Is this thing still good? March of 2024. I guess I still got some time. I haven't even opened this yet. It's the last box. Paperweight. I don't know. I don't know what I'm gonna do with it. We'll see.